Yesterday, the Office of National Statistics in the UK published data with estimates of the numbers of people that self-identify as long COVID patients in the UK in February 2021. They have to say self-identify because there are a large chunk of these people that never got a COVID-19 test. They have no definitive proof that they ever had the COVID-19 infection. They're having to rely on a clinical diagnosis of the symptoms that are included within their long COVID experience. I know that because I am one of those patients. I am within the 1.1 million. I still have ongoing long COVID symptoms. So I would say any long COVID patients watching this, I see you. I know exactly what you're going through. And I'm here for anybody that needs support or advice. Please do just email me, info@stripylightbulb.com. The 1.1 million people need support. Of those that are able to go back to work, they need support from their employer. And as many of their symptoms are overlapping with ME/CFS, and even a lot of those people are now receiving an ME/CFS diagnosis from their doctor, employers should do our business e-training. We created our e-training in September 2018 because we noticed that of the small percentage of ME/CFS patients who are able to be in employment, a lot of them were not receiving appropriate or adequate support from employers. That's where our business course originated from. So I would ask any long COVID patients, if you are experiencing difficulties with your employer, please do ask that their HR team or their occupational health team does our training, because it gives them a solid grounding in post-viral illness. I have to make it clear, not every case of ME/CFS is triggered by viruses. There are multiple triggers, including chemical overload, grief, surgery, accidents, trauma. But most cases are triggered by viruses, which is why we have been saying since the start of the pandemic that a virus that is part of a pandemic is going to trigger a lot of cases. And that's come true. So please encourage your employers to take part in our training. We are a social enterprise. 50% of our surplus goes to ME/CFS research. So as we all know now, any research that happens with long COVID or ME/CFS benefits the other patient community. So it's a win-win. You will get more adequate support in the workplace, but you are also helping to fund ME/CFS research. Worryingly, at the same time as seeing 1.1 million people self-identify as long COVID, Chris Whitty has now said we have to start thinking of COVID-19 as flu, and we have to learn to live with it. Here are my thoughts about that. At the moment, 4,000 people every day are catching COVID-19. And that's a low figure because yesterday, again, I saw statistics saying that only a small number of people are even bothering to get a COVID test. Only people that get tests are included in statistics. So 4,000, we'll just take that as the figure, even though it's not going to be correct, because if even double that, if even half people don't bother getting a test, that could be 8,000 people a day. Anyway, so if we start treating, and I've seen quite a number of people say, well, we don't have things like long flu or long pneumonia. What makes long COVID special? No, we didn't have long flu. We had ME/CFS. ME/CFS has been around since the 1950s. Post-viral illness is not new. But long COVID as an idea is new. They chose long COVID because a lot of people were having different experiences. There is the ICU version, the organ damage version, you don't get organ damage from flu, and the post-viral version, and the persistent viral symptoms. So anyone that's saying, oh, long COVID's made up, it's no big deal, have you never heard of post-viral illness, it's no big deal. Well, I've got issues with that because ME/CFS is a big deal. 25% of people are bedbound. It's not an insignificant illness. It might have a long COVID, might have a new name, but the experience of the stigma surrounding it, the not being taken seriously, being told by your doctor that it's anxiety, that you should just go out and exercise and make yourself feel better, that talking about your illness makes you an incredibly negative person. All of this is encapsulated within the ME/CFS patient community. And that's why our training is also suitable for long COVID, even if not every long COVID patient has ME/CFS-like symptoms. The experience is the same. So I would encourage any HR managers, please do our training, because I think the pandemic has laid bare that post-viral illness is not understood. As I've said already, the government policy at the start of the pandemic did not take chronic illness into account. It was already known that 30 and 40-year-olds are more likely to get a post-viral illness. And yet, what was done to protect 30 and 40-year-olds? Chronic illness isn't deemed as serious as death, obviously, but it should be taken seriously, because patients often can't ever return to work, have difficulty getting disability benefit because they can't prove that they are disabled. Because I look absolutely fine. This is because I'm having a good morning, but this afternoon I won't be able to function. ME/CFS is an incredibly complex disease, as is long COVID, but you need to know the basics, the fundamentals of post-viral illness and what chronic illness can do to a human body. So I would encourage anybody to do our training. And please don't think that COVID-19 is no big deal. Any virus can cause chronic illness. COVID-19 is a particularly nasty chronic illness. So it should be taken seriously in terms of the context of chronic illness. So any questions about long COVID, please do message me, whether you are an employer, a healthcare professional or a teacher, because they also said, the ONS, that 43,000 children and young adults identified as long COVIDs in February 2021. That's on top of the 25,000 children and young adults that already had ME/CFS in the UK at the start of the pandemic. So that's 70,000 children and young adults with a chronic illness that you need to learn about. So please, please, please take a look at stripylightbulb.com. Help us to spread the word. We are a social enterprise. We do not have the budget for a massive advertising campaign, so we rely on people helping us to spread the word. And this is such a big issue. 3 hours of training and you could help a lot of people. You could offer adequate and appropriate support to a vast number of people. Please do take long COVID and obviously ME/CFS, because that is why we were created in the first place, seriously. Thank you.